Welcome to my YouTube channel, Homeopathic Super Sessions by Dr. Jargos. Today, let us see part 4 of Totality of Symptoms. Its importance in homeopathic prescribing. So, this is very important because in the exam, you get a full question, describe totality and state its importance in homeopathic prescribing. So, there are various points, but out of that, the first point, that is the individualization of the case, is of extreme importance. So out here, the importance of prescribing are as follows: individualizing the case, diagnosing the case, identifying the nature of disease, prognosis of the case, planning line of treatment, identification of the pathology, identifying the miasm, the susceptibility, the sensitivity of the patient, identify suppression and its effects, and identifying the correct remedy. Also, it includes the selection of potency, repetition of remedy, auxiliary line of treatment, prophylactic measures, and advising the correct diet and regimen. So all these points have to be taken into consideration, but the most important point is the first point, that is individualization of the patient. So in this part 4, let us see a few points. Let us see now explain each point in brief. Individualizing individualizing the case. Well, individualization is the essence of homeopathic prescribing. We have to individualize the patient, the medicine, and the homeopathic pathology. Now, this itself is a very long topic. It is not possible to give it in this video. I'm going to make a video on individualization, which will be coming up shortly, say within a month or two. You can also refer that video for more details about the same. So basically, we have to individualize the patient, the medicine, and the homeopathic pathology. Now, diagnosis of the disease. Diagnosis plays an important part. Diagnosis of the disease can be done by taking into account the common symptoms of the disease manifestation. So whatever symptoms are common symptoms, these symptoms help in the diagnosis of the disease. They may not be any use to identify the symptom. It can be supported by lab investigations if needed, and diagnose the disease will also help in judging the prognosis of the case. Then identifying the nature of the disease. The totality will help us to classify the disease according to Hahnemannian classification of the disease. So once we get the totality, we have to see under what classification of Hahnemann does the symptom appear. For example, is it an acute disease? Is it a chronic disease? Is it a one-sided disease, etc. Then prognosis of the case. The totality will tell you if the case is curable or not, because as I told you, the types of totality, you're getting the curable totality, you're getting the incurable totality, and so on and so forth. So in the prognosis, the totality will tell you if the case is curable or not. The pathology or investigations will further support it, and the fundamental miasm has to be identified, which help in prognosis besides diagnosis of the disease. So from the homeopathic point of view, we have to see the fundamental miasm of the patient, or that is we have to identify the predisposition of the patient. So predisposition will tell you the genetic or the hereditary influences which affecting the patient or the individual. So more the miasmatic load, the prognosis will be grave. Less the miasmatic load, the prognosis may be fair or good. So it depends. For example, if the fundamental miasm is SORA, you know in SORA, there are always reversible changes, there are functional disturbances, so the prognosis will be good. If the fundamental miasm is psychotic in nature, and the pathology is a borderline pathology, or it is the reversible pathology, you know that the prognosis will be fair, and the psychotic miasm, everything is very slow, everything is very dull. The pace of the disease is also very slow. So you have to explain to the patient that it may take a long time for you to get all right because of the psychotic miasm. So this is how we have to identify the fundamental miasm to identify the prognosis of the case besides knowing the diagnosis of the disease. Planning line of treatment. It will depend upon the type of disease classification the totality falls into, or the Hahnemannian classification. So, according to the classification of disease, your line of treatment will take place. Suppose it's an acute case, then naturally the acute remedy will be there. So you have to think about the acute remedy. In a chronic case, you have to see about the constitutional remedy. In an acute exacerbation, you have to see the phasic remedy or again the acute remedy. So it depends upon the presentation of the case, what is the Hahnemannian classification of disease, and accordingly, the line of treatment will vary according to the classification of the Hahnemannian line of disease. Now, identification of the pathology. Here we take into account the relevant investigations and then decipher the pathology of the case. So the pathology will be seen to the investigation reports, and after seeing all the reports, we can come to a conclusion. Pathology could be reversible, it could be irreversible, or it could be a borderline case between reversibility and irreversibility. You're not very sure that after giving the homeopathic similimum, the pathology may be reversed or may not be reversed. So it's a borderline case. So if you're lucky and if your remedy is correct and if the patient's susceptibility is good, throwing out characteristic symptoms, it may so happen that after a long aggravation, the patient will be, the pathology again will be reversible after a long aggravation, but final improvement in health of the patient. Hence, observation number 2. Then identifying the miasm. Here we take into account the Hahnemannian pathology. That is, we have to identify what is the dominant miasm and what is the fundamental miasm. So the dominant miasm is evident through the presenting complaints or chief complaint of the patient. So when we take a case, we take into consideration the chief complaints, the origin, duration, progress. So that part of the case of the chief complaint along with ODP will tell you something about the dominant miasm. Whereas the fundamental miasm will be obtained from the family history and it is supported by the past history of the patient. So you go through the family history, see what diseases are there. So you may get only one miasm or you may get more than one miasm. That is a complex miasm. So if a single miasm is there, it is simple to treat. If a complex miasm is there, it is difficult to treat, but though not impossible. So the fundamental miasm is the basic miasm where it nurtures or the disease gets its, what you can say, gets its nourishment to activate, to grow, to become more stronger, and then or for the progression of the disease. So the fundamental miasm is the soil on which the disease will thrive and it will grow. So therefore, you have to identify that correctly. And second is the dominant miasm, evident through the chief complaint or the presenting complaints of the patient. So totality will help you to identify both the fundamental miasm as well as the dominant miasm of the patient. Well, other points will be taken up in the 5th part. Thank you for your hearing.